Right now, let's spend a few with Dr. James Pinkney. Dr. James is a healthcare reform expert, and we saw this study yesterday and wanted to go a little more in depth, Dr. James. It's to do with healthcare, more people in the system, but it seems like as those people come into the system, more and more doctors are saying, "No mas, I'm out." What's the story behind that?
That's exactly right. With the Affordable Care Act, it's guaranteeing access to health insurance, but access to health care is plummeting, and that's the most important thing that I want listeners to realize, is that just because you have health insurance doesn't mean you'll be able to see a doctor.
So why is it that the doctors are getting out of the business? Is it a lot of them are retirement age? Is it all the new paperwork? Is it just the crush of new people they can't keep up? What's really driving that?
It's a multifactorial issue. There's a lot of things going on in family medicine. Doctors are getting out left and right. They're retiring. They can't keep their doors open. So, for instance, in my other model, when I accepted insurance, a flu test cost me $13.40, but an insurance company reimbursed me $4.80. So I'm losing money. It's impossible to run a business under the current insurance model. With the Affordable Care Act, reimbursements have gone down even more, and that's why physicians are not accepting the exchanges.
And it's interesting, I guess. It's kind of like when you hear guff from teachers, and you talk to teachers, and the whole reason they got into the business was because they want to help kids. So it's like, well, the other stuff shouldn't matter as much. It's like with doctors. I mean, doctors generally have great sympathy and empathy. They want to help people. So when you hear this, that the doctors are talking about getting out of their expertise, it's very troubling to hear.
It is. We got into medicine to help others, to save lives, to change lives. And unfortunately, now we're doing paperwork more than anything. So doctors are working about 60 hours a week and spending another 15 hours a week on paperwork, charting, filing insurance claims, trying to collect the insurance dollar. 17 cents on the dollar as healthcare costs skyrocket. We've got to make a change, and that change is Diamond Physicians. So I came up with a completely different model, cutting out the insurance companies completely, charging a monthly membership fee starting at $45 a month for kids. Adults are $95 to $295. So a couple $100 a month, and you receive unlimited visits, no copay, 24-hour access to your physician, email, text, cell phone access. All your acute medications and all your acute procedures are included. It's an unbelievable deal, and that's how we're going to lower the cost of healthcare globally.
Dr. James Pinkney, our guest, he's a healthcare reform expert. When you introduce something like that, is there any chance that that might start to drive the market? I mean, with that kind of information and that kind of plan out there, do you get any sense that the government is paying attention, that other doctors are paying attention, and they might start using that model rather than the one we currently have?
Yes, physicians are definitely paying attention. We are creating market share. The government isn't paying attention yet. I've written letters to senators, House of Representatives, congressmen. They're not listening yet, but they will. We save so much money by introducing cost transparency and creating competition, which drives down prices. So I can get an MRI for $400 instead of $4,000. CT scan for $300 instead of $3,000. CBC $5 instead of $80. Cholesterol check $6 instead of $128. And that's how you lower the cost of healthcare, is by practicing fiscal responsibility.
Well, I got to tell you, as someone who has recently gone through hip dislocation and bone fractures, and starting to see that information come in from the hospitals and from my insurance, though your numbers sound a lot better than the ones I'm seeing on the paperwork.
Yeah, unfortunately, the cost is astronomical. The markup is thousands of percentiles, and it has to change. The cost of healthcare is rising at twice the rate of inflation. We spend the most money by far on healthcare out of any industrialized nation, and we're 17th on the list. We are not number one by a long shot.
I got you. Dr. James Pinkney, I appreciate the time. Of course, Dr. James, a healthcare reform expert.